Hi folks, John Adamson, the Rehab and Documentation Guru, enjoying a beautiful spring day, even in the midst of the coronavirus. And part of the reason I'm enjoying it and just sitting in my car is I'm waiting to go see a patient because my caseload has been rather decimated, as probably many of you have faced. So anyway, I hope you're keeping sane. I hope you're paying your bills. Of course, protect yourself and your family. But what I thought I would do is make a video about a question that a viewer of mine had, which was to include a starter phrase related to doing a reevaluation, or some of you might call it a reassessment. So with that in mind, I've put together this brief presentation, which I'm going to upload for your perusal. And, I wouldn't mind getting some comments to see what you think. So the question might be, what section of your documentation would you use to justify a reevaluation? Unfortunately, in the midst of recording this, I can't have any fancy, uh, you know, analysis word coming into the slide, but anyway, there it is. We would use the analysis. This is the main justification part of your documentation to prove medical necessity. It's one of the most important parts of any document that you document, and so we're going to be focusing on the analysis. So those of you who have been following my channel for a while know that I did a video on a blueprint for a solid analysis. If you've been to my course, Documentation Bootcamp, you've seen me talk about a solid analysis. So using some of those same principles, here is a template for analysis when you're doing a reevaluation for you to consider. And of course, there's going to be a lot of alterables here. There's things that you've got to fill in for your specific patient. So you might start off by saying something to the following effect. Patient presents with the following functional deficits and underlying impairments. And you might remember from my course, we talk about those things as being the main measurements that you focus on. Functional deficits, of course, we understand the functional areas that any third-party payer is going to be worried about. And then underlying impairments are those root causes of the functional deficit that you better know how to measure. Then you might continue by saying something like this. Patients' test scores on standardized testing include. So then you give them some detail about those test scores. And then, because we're justifying a re-eval, which is a code you only should be billing when a patient has some kind of significant change, you might say something like this. There is a significant change from the patient's clinical presentation that was utilized to develop the previous goals and treatment interventions, including the above noted findings and blank. Now, whatever that blank might be, there might be like a new medical issue going on that will, as you know, cause new underlying impairments that you better learn how to measure. So these things are going to have to be stated here for your individual patient. It could be a socioeconomic issue that significantly changed the patient's capability of achieving their goals. It could be that Humana told you that originally you were going to be discharging them in 2 weeks, and Humana said, no, you got until tomorrow. So, so that might cause you to significantly reroute, rechange how you're approaching that patient's care. So anyway, you want to keep on developing this statement. These changes necessitate the following updates to the plan of care, further necessitating a reevaluation. So whenever there's a significant change, that would help justify the reevaluation codes that we have that we're allowed to bill. So changes to, think about this, if your goals are going to be impacted, if your treatment approach is going to be impacted, you should do a reassessment or reevaluation. That just makes sense. And then, to wrap up any analysis, when you're ongoingly treating a patient, it would be good to have a statement that basically says this. It would be neither safe nor effective to discharge patient at this time due to. And then elaborate on what is the problem here. Why couldn't they be turned over, even in the midst of this significant change, to a non-licensed person to handle the situation? So this is a blueprint in general for analysis for patients that are getting reassessment or reevals. And there, folks, you have it. So, as previously discussed, analysis has a basic format that helps justify medical necessity. As you've seen in a previous video of mine, or if you've been to my course, I talk about the fact that analysis is like telling a parable. It's a story with a deeper meaning. And if you do a good job of telling a parable, therefore, a nurse reviewing your claim is going to find out something they would not have guessed on their own, given the data. You've got to explain it to them. And in this case, we're just trying to explain what the reevaluation code is for. Anyway, hope you like it. Hope you subscribe. As always, send your recommendations for future videos. I've got a couple more things I want to attend to at some point here, but send those suggestions. I appreciate it. Take care and God bless and keep healthy.